Hello, my name's Amanda. I'm going to be your nurse today. Can I just have you verify your name and date of birth for me?
Robert A. Januszewski, November 26, 1959.
Perfect. And I'm just going to take a look at your name bracelet. Okay, Robert Januszewski, date of birth matches. Perfect. Okay, I'm just going to go ahead and wash my hands quickly. Okay. And as I walked into your room, I was checking the floor, making sure there was no sorts of cords on the floor, anything that you could trip over, anything dangerous. Your bed looks like it's in a great position. So I'm going to go ahead and just grab a pair of gloves. We won't need to put those on yet. I'm going to go ahead and close the curtain for a little bit of privacy here. And I just have a couple questions for you before we start the exam, okay? We're just going to do a head to toe exam from the top to the bottom. Make sure you're feeling okay. Now, and what brings you here today? I read that you were having a little bit of stomach pain.
Yeah, every now and then I just get like cramps and stuff in my stomach.
Okay. And what would you rate that out of 0 out of 10? 0 is no pain at all. 10 is the worst pain you've ever felt in your life.
Probably about a three or
A 3 or a 4. Okay. And is it a constant pain or does it come and go?
um when it gets really bad, I try like going to the bathroom, and sometimes if I pass a lot of gas, it
That
gets
helps.
gets a little better.
Perfect. And are you taking anything for pain? Tylenol, ibuprofen, Advil,
I took some gas X.
Gas X. Okay. Right. Perfect. And is that like a sharp pain or is it kind of a throbbing pain?
It's kind of like constant, but every now and then it kind of like spikes where it's like
Okay.
it hurts.
Okay. All right. And it's in your lower stomach. Okay. And I see you don't have an allergy bracelet on, but I just want to double check. Do you have any allergies?
Nothing I'm aware of.
No allergies. Okay. Excellent. And how is your appetite? Are you eating okay? Is the food here okay?
I've had better, but
Oh, okay.
I am eating.
Okay. And do you know where you are right now?
Yeah, I'm at the hospital.
Okay. And do you know what month it is?
The end of September.
Okay, perfect. All right. And we know what brought you here, the stomach pain. So patient is alert and oriented times 4. Perfect. He is making proper eye contact with me. Just by looking, he does have good hygiene. Are you sleeping well? How much would you say you're getting of sleep here at the hospital?
Usually broken up like maybe a total of 5 or 6 hours.
Oh, 5 or 6 hours. That's pretty good. Okay. All right. Perfect. And I am going to go ahead and start the exam if that's okay with you. Is
Yep.
it okay if I touch you?
Yep.
Okay, perfect. And so first, what we're going to do is I'm going to put my gloves on. If we were in a hospital and I had the controls, I would then raise the bed to my waist level, so I wasn't bending, turning, anything like that. Okay. And we're going to do the vital signs. We're going to do the blood pressure, pulse, oxygen rate, and respiration rate. All were in normal limits. Okay. And to start here, I am just going to start. I'm going to put my clipboard here in case there's anything I need to know. So I'm just going to start with your scalp. Just look for any abnormalities, bumps, anything like that. And that looks good. I'm going to check your temporal pulse. Okay, excellent. And on this side, perfect. And your face is symmetrical, no signs of stroke. Can you smile for me? Okay, perfect. All right. And then I'm going to go and check your neck here. Let me know if there's any pain, okay?
Okay.
Trachea is in line. I'm going to check your carotid pulse. Okay, and I'm going to check the other carotid pulse. Perfect. I guess you have a therapy animal in the room with you today, sir. Okay. And that looks good. I'm just going to give a little pinch here at your clavicle just to see if there's any signs of tenting for your skin, which would be a sign of dehydration. But that looks great. Excellent. Okay, and I am going to have you go ahead. I'm going to check your eyes. Perfect. Perfect. And both are equal, round, and reactive to light. And I'm going to have you go ahead and stick out both of your arms and grab my hands as tight as you can. Okay, good grip. Okay, so I'm going to have you go ahead, palms up like this, put them straight out with your eyes closed, and just hold them there, okay? All right, no drift at all. Patient seems very steady. Okay, sir, you can lower those down. Okay. And as I am doing this exam right now, I am checking all parts of his skin, looking for lesions, bumps, bruises, anything out of the ordinary, looking for any skin breakdown. So now, sir, I am going to listen to your heart sounds. So would you feel more comfortable if I kind of pulled your shirt around, or would you like to just take your shirt off? Okay, perfect. All right. So I am going to check your heart sounds. So I just would ask you not to talk. All right. So the first spot I will be checking is the aortic and the second right intercostal. Perfect. And the pulmonic and the second left intercostal. Sounds great. Herb's point. Sounds great. Tricuspid, which is the lower left sternal border of the fourth intercostal. Sounds great. And then the mitral, left fifth intercostal. Perfect. And then I'm going to turn my stethoscope around and listen with the bell of my stethoscope for any sort of heart murmurs. Okay, perfect. That sounds great. So now, sir, I'm just going to go ahead and listen to your lung sounds, okay? So when I move my stethoscope, I want you to take a deep breath each time, okay?
Okay.
All right. All right, go ahead. Deep breath. Good. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Okay, everything sounds great on the front. So now I'm going to go ahead and listen to your back, okay?
Yeah.
And same thing, deep breath. Again. Okay. I'm just going to listen down in the kidney areas. Okay, and I'm going to just check on your right side here where your third lobe is in your lung. Okay, perfect. Everything sounds great. All right, so now at this point of the exam, I'm going to have you lay your head back on the pillow and relax. I did also check his back, skin, everything like that. Therapy kitty is here. Okay, now we are going to now check your abdomen. Okay, so you said you were having some stomach pain. So I'm just inspecting with my eyes. I don't see any like bulges, nothing like that, bruising, anything that would be of concern to me. So I'm now going to listen to the quadrants of his stomach. Okay, so I am going to start with the right lower quadrant. Positive for vowel sounds in the right lower. Positive for vowel sounds in the right upper. Positive for vowel sounds in the left upper. And positive for vowel sounds in the left lower. Okay. And when was your last vowel movement?
Yesterday.
Okay. And was it normal? Was it hard to come out?
It was pretty normal.
Normal. Okay.
Yeah.
And have you been having any issues voiding? When was the last time you voided? Any burning pain with urination?
No.
Okay, perfect. So I'm just going to do a little gentle touching here. You let me know if any of this hurts, okay? Okay. Everything feels great there. Perfect. All right, so now next I'm going to check your arms, okay? So you lift your arm up. I'm just going to do a little bit of range of motion with you. You let me know if anything hurts, okay? Okay, and your skin looks great. Your elbows, great, perfect. I'm just going to check your brachial pulse on this arm. Okay, perfect. And then I will be checking your radial pulse as well. Excellent. And then the capillary refill. Perfect. And in a perfect world, I would then walk to the other side of the bed to check his other arm. However, I do not have a bed like that, so we're going to check the skin on his other arm. Check his elbows. Great. I'm going to check the brachial pulse. Okay. And the radial pulse. Perfect. We're going to do a little range of motion here. And any pain with this? No. Okay, perfect. Excellent. You can go ahead and relax there. Okay. And now I am going to go ahead and check your legs. So I'm going to just pick this leg up and bend it. I'm just going to have to take these shoes off, okay? I'm going to check your heels, your skin here. Perfect. Capillary refill here. Excellent. I am going to check for any edema and swelling. Nothing. Skin looks great here as well. I am going to check your posterior tibialis pulse. That's perfect. And your dorsalis pedis pulse. Excellent. And then I'm going to your popliteal pulse. I'm going to check. Excellent. And then I'm just going to check your femoral pulse. It is a little close to the groin. Perfect. So I'm going to do the same thing on this leg. Heels, skin, everything looks great. Capillary refill, perfect. Dorsalis pedis pulse, great. Posterior tibialis, no swelling or edema noted in this leg either. The popliteal pulse, perfect. Okay, and then just the femoral pulse. Excellent. So overall, I would give him a Braden score of 22. He is little to no risk for any skin breakdown. I would also give him a Glasgow Coma scale of 15. He is alert, orientated, knows where he is. So, sir, I am just going to go ahead and cover you back up here. There you are. And then I will go ahead and give you your call light for safety, okay? If you need anything, your call light's right here. Do you need any water, anything like that?
Water would be good.
Okay, I will step out and grab that for you. I'm going to remove my gloves, throw them away. I'm going to wash my hands again. I'm going to lower his bed to the floor for safety, and I can open the curtain back up, and he is all set. Sir, you ring that call light if you need anything, okay? And I'll be right back with that water.
Thank you very much.
You're welcome.